Can everyone see my screen? Okay. Okay. So my presentation is going to be about the USMLE. So it's a sort of a guide for IMGs for us. Let me just start by talking about the presentation plan. So I'll start by talking about an overview of the USMLE, just a few sentences about each step. And then I'll talk a bit about why you should do the USMLEs. And then I'll talk in detail about USMLE Step 1 and USMLE Step 2 CK, which are the exams that I've already finished. And then I'll tell you a bit about my experience with the exams. And then I'll have some useful links at the end. And towards the end of the presentation also, we'll have some time for some questions and answers. Okay, so let's start. Okay, so the USMLEs, the United States Medical Licensing Exams, are a group of examinations that every single person who wishes to practice medicine in the US has to pass. So that's for both graduates of United States medical schools and also international graduates as well. So there are basically 3 steps to the USMLE. There's the USMLE Step 1, there's Step 2, which is divided into 2 steps, like 2 CK and 2 CS. And there's the USMLE Step 3. Okay, so first, USMLE Step 1 is the first exam that you have to sit. This exam, usually American students, so American medical students, they do this exam in their second year, towards the end of their second year. So as you know, they have 4 years of medical school there, so it's about halfway through their medical school, they have to finish their USMLE Step 1. This exam covers the basic sciences, which means physiology, pathology, microbiology, biochem, and so on. And the main focus of this exam is to test your ability to apply scientific knowledge in clinical scenarios. So I will give you some examples later on, and you'll see what I'm talking about. So the second part is the USMLE Step 2 CK, or clinical knowledge. So this is a comprehensive assessment of your knowledge of clinical sciences. Basically, American medical students, they usually sit this exam towards the end of their third year, or sometimes they can also choose to sit this exam during their final year of medical school. This exam covers the fundamental branches of clinical sciences or clinical medicine, which means it covers internal medicine, pediatrics, surgery, and so on. The main focus is that it assesses your ability to practice medicine in a supervised setting, and it focuses on clinical reasoning and decision-making. So again, I'll give you some examples later. The USMLE Step 2 CS, or clinical skills, this is a assessment of your ability to interview patients. So to take history, to perform a physical, to fill out charts, and to write down a basic differential diagnosis. So this is an oral exam, actually, and it involved interaction with actors. And these actors are pretending to be patients with some specific medical condition. So unfortunately, or fortunately, no one is sure yet whether this is good or bad for IMGs, but this exam was canceled recently because of the COVID-19 pandemic. So they announced that it was canceled for 12 to 18 months. But they recently also, 1 month ago, they announced that they will restart this exam in an online form. So as a telemedicine format. This exam used to be in person and only in the United States. So you have to travel all the way there to do the exam. So now they changed it into an online format, but no one knows how this exam is going to be because they still haven't released details. Okay, so the final step is the USMLE Step 3. So this is not an exam that is required for us to pass in order to get our certification, our ECFMG certification. So it means that you can match into a residency program and you can get your certification without passing USMLE Step 3. Usually American medical students, they do this exam after they graduate, usually at the end of their first year of residency. So it's not really an exam that they do during medical school. The main goal for this exam is to assess your ability to practice medicine in an unsupervised setting. But the main reason for us to do the USMLE Step 3 is because it is a requirement for a specific type of visa. It's called an H-1B visa. And some people, they do the USMLE Step 3 before they apply to residency programs in order to get this type of visa, if you don't have a green card or if you're not a US resident. But for us, you don't really have to do it if you don't want to get the certification. Okay, so now I can talk about some reasons to do the USMLEs. Of course, other than the fact that if you want to go to the US, you have to do the USMLEs. But other than that, there are also several reasons why you should do why I recommend doing the USMLEs during medical school. First of all, it really improves your scientific and clinical knowledge. So I really believe that the way that the USMLEs are created, or the way that you are examined on the USMLEs, is the best way to study medicine, basically, or the best way to examine you. I'll explain later like how the questions are, but it's very different than our way of teaching here in Czech Republic, or I think in many other medical schools around the world. So if you actually study for the USMLEs and you sit the USMLEs, you can really see improvement in your scientific and clinical knowledge. Also, of course, it puts you ahead of your other like medical school peers in your class. Another reason is that besides the United States, the USMLEs are recognized as a licensing exam for other countries, includes New Zealand, Qatar, UAE, Israel. And regardless of which country you choose to practice medicine in, if you have a good score on the USMLEs on step 1 or on step 2 CK, it's a really good addition to your CV. Okay, so now I'm going to start by talking about USMLE step 1. So in a bit more details. Okay. So the USMLE step 1 is the first exam that you have to do. It is a 7-hour exam, so it lasts for 7 hours, and it's 280 multiple choice questions, made of 280 multiple choice questions. Each question usually has 45 choices, but it's possible to have more than 5 choices. But there's only one possible best answer per question. So it's not like the multiple choice questions that we usually have here in the Czech Republic, where usually you have like multiple correct answers. Here, there's only one correct answer. Some choices, they may be partially correct, but only one choice is most correct, which means that you can only choose one choice and only that one is correct. Other choices may be partially correct, but only one is the best. There's a total of 7 hours for 7 blocks, which means that you get 60 minutes per block, and there are 40 questions per block, which means that approximately you get 90 seconds per question. You get a total of 45 minutes break, and you can use this break anytime between your blocks. So you don't have to sit for a whole 45-minute break. You can just divide your breaks into, for example, 5 minutes between each block. And whenever you finish a block early, the remaining time gets added to your total break time during the day. So I want to talk about some like the content areas. So what are you examined on exactly on USMLE step 1? So there are several ways we can divide the contents of step 1. So first of all, we can divide it according to the way, that's the style of the question, or what the question is examining you on. So most of the USMLE step 1 examines you on your ability to apply foundational science concepts, as I said in the beginning. So this is actually from my own score report. So this was the breakdown of the questions on my score report. So it just tells me like that 52 to 62% of my questions when I did the exam were about applying foundational science concepts. This usually doesn't change between each exam, it's the same. So most of the exam tests you on your ability to apply foundational science concepts. The second part of the exam is about patient care diagnosis, so your ability to diagnose diseases. And then there's also your ability to manage diseases, so treatment. And finally, like a small part of the exam is about evidence-based medicine, so your ability to interpret studies, for example. So this is one way of dividing the USMLE questions. Another way is according to systems. So my exam was mostly about general principles. So 13 to 17% was about general principles. So by general principles, this means general principles of pathology and physiology usually. So for example, if you've studied pathology already, this would be the first 3 or 4 chapters in pathoma. So chapters about inflammation, necrosis, apoptosis, and so on. And then also a large part of my exam was about nervous system, so neurology and behavioral health. Also, I had reproductive and endocrine, respiratory, renal, and urinary, and some immunology and hematology. I also had cardiovascular, you can see. So this is like the content of the USMLE exam. And this changes from exam to exam. So some people, for example, most of their questions come from cardiovascular system. For me, it was mostly about general principles. But of course, I got questions from each of these areas. And then you could also divide the contents of the USMLE according to the discipline. So this is how we are examined in LF2. I'm sure also in LF1, but not LF3. LF3 is according to systems rather than discipline. But according to discipline, this usually doesn't change with each exam. The largest discipline that is examined on USMLE Step 1 is pathology and physiology as well. So these are the most important two disciplines. Pharmacology, biochemistry, anatomy, embryology, and so on, microhistology, you can see here, are all disciplines that are examined on Step 1. So you don't really have clinical sciences like internal medicine and pediatrics, but rather you have basic sciences like pathology and physiology. So I want to go through a couple of questions just to show you what the style of examination is on USMLE Step 1. So I'll just read out the question, and if you know the answer, just write it down in the chat, and then we'll go over the answer together. Okay, so the first question, we have a 14-year-old boy. He's brought to the physician because of a due-day history of sore throat and fever that peaks in the late afternoon. He also has a 1-week history of progressive fatigue. He recently began having unprotected sexual intercourse with one partner. He appears ill, his temperature is 39 degrees, physical examination shows cervical lymphadenopathy and pharyngeal erythema of the creamy exudate. Which of the following is the most likely diagnosis? So, the most important skill that you can learn in USMLE while studying for the USMLE is to know how to approach questions, how to extract important information from a clinical vignette like this one. This is a rather short clinical vignette. A lot of them are very long, so you don't have a lot of time to finish this question. You only have 90 seconds. So a really important skill is to be able to extract important information. So I'll show you like how I approach the question, and then we can answer it together. So first of all, this is a 14-year-old boy. So they're trying to tell us that this is a disease that is common in adolescence. And there are certain diseases that like are very common in adolescence. This is one of them. This patient, the main complaint is that he has a sore throat and a fever that peaks in the late afternoon. So this is a specific character of fever as well. It gives you a hint to what the disease is. He has a week of progressive fatigue. Again, this is very important because this disease specifically can present with only fatigue. It's one of the most important symptoms. And again, they're giving you something about the history of the patient. He's recently started having unprotected sexual intercourse, which means that they're probably trying to tell you that this disease is related to sexual intercourse. So it's a sexually transmitted disease. He has fever and he has cervical lymphadenopathy. Already at this point, you should be able to know what this disease is. And then they give you the final hint, which is pharyngeal erythema with the creamy exudate. So there's only one disease from this list of diseases that presents like this in adolescents with these symptoms. So I'm gonna look at the chat to see if anyone answered this. Yeah, so several people answered it correctly. So the answer is infectious mononucleosis. So according to so I'll tell you what this question examined exactly. So according to patient care, so this first part here, according to this content area, it was examining your ability to diagnose. So it gave you a clinical vignette with the patient, then you have to diagnose the disease. According to system, this was hematology and immunology, because this is a virus that infects B cells, right? So this is hematology mostly. And then according to discipline, this is microbiology. So it's a virology more specifically. So this is an example of a question. This was a relatively easy question. You won't have a lot of these on your real exam, but it's really important to know how to extract information from this question. Let's go to the second question. So a 52-year-old man is brought to the emergency department 30 minutes after he had an episode of chest pain radiating to his jaw while shoveling snow. His pulse is 80 per minute, blood pressure is 130/70, the lungs are clear, cardiac examination shows an S4. And then while undergoing an ECG, the patient says that he feels a chest pain returning. The most appropriate immediate treatment is a drug with which of the following mechanisms of action? Okay, so again, let's extract some important information from this stem. A 52-year-old man, so this is a middle-aged or slightly older man. He's having chest pain radiating to his jaw. So already you should know what the diagnosis is, what this patient is suffering from. Pulse and blood pressure is fine, lungs are clear, cardiac examination shows an S4. So again, this is also an important hint to what he's having right now. And then the main complaint of this patient is that right now he's having chest pain. The chest pain is returning. So then they're asking you the most appropriate immediate treatment. So you should already know what the most important immediate treatment is for someone with returning chest pain. And then not only are they asking you what the drug is, they're also asking you about the mechanisms of action of this drug. So this is a several step question. So they're not just asking you a specific direct question, but you have to jump through several hoops in order to reach the answer. So let me check the chat to see if anyone has answered this correctly. Yeah, so the answer is B. So this is nitrates. So for example, sublingual nitroglycerine, which is the first line agent for treatment of chest pain. This patient probably has an MI, and then right now he has like returning chest pain. So you have to give him something to relieve the pain. And the way that you do that is through nitrates. And the way that nitrates work is by increasing nitric oxide concentration. So this is a question that examines you on your ability to manage the patient, so patient care management. In terms of system, this is cardiovascular system. And in terms of discipline, this is pharmacology. So these are two examples. And while you're preparing for your USMLE, you're going to see many, many questions, thousands of questions. So the skill, like the ability to extract important information really quickly, hopefully you'll be able to develop. The more questions you do, the better you get at extracting important information from a clinical vignette. Okay. So now I'm going to talk about some study resources. So what are the resources that are available for the USMLE Step 1? So in terms of books, there are a lot of books that are available. But the most important book that you need to buy for the USMLE Step 1 is the First Aid for the USMLE Step 1. So First Aid is really the best book. It's not only the best book for USMLE Step 1, it's really one of the best books for medical school in general. Like I bought this book in my 3rd year, and I still use it right now in my 6th year. So it's a really important book. Everyone should buy it. The second book is Pathoma. Again, this is a really important book. You have to buy it and you have to use it for your medical school and also for studying for USMLE Step 1. Then there's another book also that I really recommend you should buy is Master the Boards, USMLE Medical Ethics. So a part of this exam of USMLE Step 1 is ethics. So you'll see it over here. It's part of behavioral health, but it basically tests you on ethics, ethical principles of medicine, which I'll give you an example of a question about ethics later when I'm talking about USMLE Step 2 CK, because you also use this book for USMLE Step 2 CK. So I really recommend that you buy these 3 books if you want to pass or do well on your USMLE Step 1. There's also Amboss, which is not really a book, but it's a library. And I also recommend using Amboss, not so much for USMLE Step 1, more for USMLE Step 2 CK. I didn't really use it at all for Step 1, which is why I didn't give it like 5 out of 5. But I think our faculty gives it for free anyway, so you should use Amboss if you can. In terms of video resources, I'm a huge fan of videos in general. This is how I learn. I watch videos. Pathoma, everyone knows about Pathoma. It's really the most important resource you'll use for pathology in your 3rd year. So when you're studying for the exam. Not only that, but of course you'll also use it for the USMLEs. Personally, I didn't use Pathoma that much while studying for the USMLE exam because I used it a lot when I was studying for my pathology exam in my 3rd year for medical school exam. So I didn't really use it that much. But of course, most people use it really. It's a must-use resource. So the videos made by Dr. Sattar on Pathoma. Sketchy Micro. This is basically the only thing you'll need for microbiology on USMLE Step 1 is to watch Sketchy Micro videos and make notes or use their cards. But Sketchy Micro is really important. So it's a must-use resource for USMLE Step 1. And then Boards and Beyond. So personally, this is my personal favorite resource, is Boards and Beyond. So I've recommended this resource to a lot of people. I've talked about it a lot. But Boards and Beyond is a comprehensive resource. It covers everything in USMLE Step 1. So all the subjects, all the disciplines, all the systems. It's video lectures. There's also a Q bank. There's also a book right now, I think. So this was the resource that I used most for studying for USMLE. It was Boards and Beyond. I used it before starting my dedicated preparation, and also I used it during the dedicated preparation. So it's a really important resource. This is my personal recommendation. Not everyone uses Boards and Beyond, but I really recommend it. And if you have more questions about how to use it, you can message me after the presentation. In terms of Q banks, UWorld, of course. So this is the gold standard for studying for USMLE Step 1 and Step 2 CK. So UWorld is I'll talk more about it later, but it's a QBank. So it has like practice questions. And then Amboss, you can also use it if you want. Self-assessments are, of course, really important. This is just a way to track your progress during your dedicated preparation. So there are several self-assessments that are available for USMLE Step 1. There are the UWorld self-assessments. So these, they come with the UWorld subscription. And there are NBME self-assessments, which you have to buy, I believe, for $60 for assessment. There are 5 or 6 of them. Other resources, so we have like flashcards. They're highly recommended by everyone. And I'll talk more about how to use it later. There is a podcast called Divine Intervention Podcast. And it's a podcast that really covers everything for USMLE Step 1. So I listen to Divine Intervention Podcast in my free time. So you should try to do that as well. Like starting from now, I started using it for a while before I did my USMLEs. So I think it's a really important resource. In terms of Kaplan, a lot of people have questions about Kaplan because like they really advertise a lot. But I really think it's a waste of time and it's a waste of money. Like no offense to the Kaplan people, but I really think that this resource is not that good. It has too many useless details in their books and in their videos. It wastes a lot of time, basically. The only Kaplan that I actually do recommend is Kaplan Pharmacology. So there's a Kaplan Pharmacology book, and there are videos by Dr. Raymond, and I actually use those for my 4th year pharmacology exam. So I do recommend the pharmacology book and videos, but nothing else really. Don't waste your time on Kaplan resources. I don't think they're that good. Okay, so I'm going to talk a bit about how to use each resource, only the really important ones. So first, UWorld. So I think everyone should buy UWorld, of course. If you're going to do the USMLEs, you have to buy UWorld. It's a bit expensive, but it's definitely worth it. It's the highest quality QBank. And overall, it is the best study resource for the USMLEs. So everyone agrees about that. It has a lot of questions. So it's like 3,300 or more practice questions. And they keep adding new questions because when I did it, it was only 2,500 questions. Now it's 3,300 questions. And they cover almost every topic. So every single topic you need to know for Step 1 are covered. These topics are covered by questions, practice questions found on the on UWorld QBank. After you do each question, you answer it, and then it's followed by the correct answer and explanation. And they're really good in their explanation. So they have diagrams and pictures that really help you understand difficult concepts, which is why this is really the highest quality resource for USMLE, is the explanations for UWorld. So how to use UWorld or how I use it, there are several ways to use it, but how I used it is I only did timed random blocks of 40 questions. So that means I did full blocks. So they give you the option to choose how many questions you want to include per block and whether or not you want the timing. So you want like a time limit for the block and whether you can pick like questions according to system. For example, you can pick cardiology questions or immunology questions. But I recommend that you always do your questions randomly. So you don't choose a specific discipline or a system, and you always do exactly 40 questions, and you always choose timed mode because this simulates the real exam. And the more you do, the more blocks you do, the better you'll get, and the more used to this form of examination you'll get, which is really helpful for the real exam. Another recommendation I have about UWorld is that you have to review every single question. You have to read the full explanation. So just because you got the question correct on UWorld doesn't mean that you can skip the explanation. You have to really read every explanation because that's how you learn for the USMLEs. So for example, I realized when I was studying that I was okay at the questions that I got incorrect. So the questions that I got wrong on UWorld, I really memorized them and I memorized the explanation and I was really good at them. But then the questions that I got correct, I just skipped in the beginning when I was using UWorld. And the ones that I skipped, later on, they might ask me a question about the same concept, but in a different way, and I got that incorrect. So what I'm saying is really you have to revise the incorrect questions as well. You also have to make Anki cards for every new concept. So I didn't really do that much when I was studying for Step 1, but for Step 2 CK, I realized that this was really important. So you have to make flashcards for every new concept. So while you're doing your, or after you finish each block, you go through your explanations, and then for every new concept that you see, you create a card, and then you review these cards, and I'll talk more about how to use Anki in a bit. I think I have a question from Dana. She said, how early should we start UWorld? So yeah, this is a very common question. People disagree about like how early you should start UWorld. Some people say you should start UWorld like very early, few months before your exam. Some people say you should start only during dedicated. For me, my recommendation is to only do UWorld during your dedicated preparation, which for some people who don't know what dedicated preparation is, I'll explain in a bit. But my recommendation is to only use UWorld during dedicated. So in the first month or in the last month or two before your actual exam. I only recommend going through UWorld once, and then the second time to only go through your incorrect questions. So some people go through UWorld 2 or 3 times, but I don't recommend that. I don't think that's useful. I think what's useful is to go through UWorld once. So covering every single question, doing every single question properly, reading all the explanations, and then the second time you can go through your incorrect questions only. I think it's a waste of time to go through UWorld twice or 3 times. I don't think that's very useful. Okay, so the second resource is first aid. So as I said, this is the best textbook for step 1. It contains most topics that you need to know, and it's in a concise bullet point format. So there isn't a lot of text. There's just bullet points about the really important high yield information. And it also gives you a lot of space to add your own notes into the book. How I used first aid is I bought it in 3rd year, and I used it as a reference throughout like medical school. So throughout my 3rd year exams, I used it as a reference. So whenever I had, for example, my pathology exam, I would reference the area that's in first aid. For example, if I was studying inflammation, I would look at the inflammation part in first aid. I also watched Boards and Beyond videos. And then for every video that you watch, it gives you the corresponding first aid page. So I just flip to that page, I watch the video, and I write down notes in my first aid according to the stuff that's being said in Boards and Beyond. And I think that this is the most useful or the best way to use first aid is to combine it with a video resource. In my opinion, the best one is Boards and Beyond. Okay, so Pathoma, again, this is like excellent videos and an excellent textbook that covers the main pathology topics in USMLE Step 1. So one of the most important things for success in USMLE Step 1 is to have a strong foundation in pathology because pathology is the most important subject in Step 1. So how do you get the strong foundation in pathology? It's by watching Pathoma. And the way that you use it is as a main resource for studying pathology in 3rd year, which I think most people do that already in our faculty at least. So most people use Pathoma as the main resource. And I think that's the best way to use it really. So during the 3rd year or when you're studying for your pathology exam, you watch the Pathoma videos and you read the textbook, you highlight or you make your notes in the textbook, and you really memorize or at least try to understand every single concept in that book because they're all really important. Some people also use Pathoma during dedicated preparation. So during the few months before the actual exam. I didn't do that myself. That's because I used Pathoma a lot during my 3rd year, so I didn't think it was very useful for me during dedicated. Instead, I used Boards and Beyond. Okay, so Sketchy Micro, again, most people use this resource already in our faculty studying for microbiology exam. So it's videos that cover everything, basically, you need to know about microbiology for Step 1. This is a must watch. So my exam, there was nothing that I could not have answered without Sketchy Micro. Every single question regarding microbiology was covered by Sketchy Micro. So really, it's an excellent resource that you have to watch or you have to use. So how to use it is to use it as a main study resource for med school micro exams and to watch it as many times as possible. Like that's it. That's how I did it. So I watched each video maybe 6 or 7 times, like throughout medical school and throughout my dedicated. Someone is asking about Sketchy Farm. So Sketchy Farm, again, a lot of people recommend Sketchy Farm. I personally didn't use it because I tried using it I use it for antibiotics only. And I thought that the videos were too long for me because like the best thing about Sketchy Micro was the videos were very short. So it was very easy to remember the pictures, the sketches, but I didn't really like Sketchy Farm because it was very long and the videos were very complicated. It wasn't very useful for me, but a lot of people actually use it and a lot of people recommend it. I personally haven't used it, so I can't I personally don't recommend it. So I don't really think it's one of the best resources for USMLE, but some people do think though. Okay, so next, Boards and Beyond. I have a lot to say about Boards and Beyond. Really, it is extremely useful for us, for IMGs, because it pretty much covers the entire preclinical medical curriculum. So it compensates. So this compensates for the lack of standardized teaching that we have in our faculties. The biggest problem in our faculties, and I think in a lot of medical schools outside of the US, is that there's no standardized teaching. There's no standardized examination. So the amount of things that we learn is like different according to, for example, what the professor wants us to learn. So if the professor wants us to learn details about cystic fibrosis, for example, we'll learn so much details about cystic fibrosis, but then we won't learn important things about other diseases or other aspects of medicine. So I think watching Boards and Beyond during your preclinical years, during first, second, and third year, also fourth year, watching the Boards and Beyond videos, using them as a main resource for studying for your medical school exam is really important. It'll really give you like a baseline for like that you can build on when you're studying for the USMLEs. So how to use Boards and Beyond, again, use it as a main source of information throughout the preclinical years. I watched the videos for every subject while studying for the medical school exam. And especially during dedicated, I used it by watching videos on subjects that I did not perform well on the self-assessments. So I'll show you like in a bit how to use self-assessments properly. But at the end of self-assessments, they give you a review of what subjects you didn't perform that well on. And according to those, to your self-assessments, you can then watch videos in Boards and Beyond, and it will really help you improve your knowledge in these subjects. So, Anki is a really important, very powerful tool, and it's free, so that's really good. It utilizes spaced repetition to improve your memorizing capabilities. So what this means is, so you have like for example, 50 flashcards that you've made. You go through them one day, and then they'll repeat again in a few days. You go through them again. Someone have a question? Okay. So spaced repetition is really like helpful for memorization, especially when you're memorizing a lot of details, which is very common when you're studying for medicine. So Anki is a really powerful tool for memorization. How to use Anki? Anki, there's like several opinions. A lot of people, or I think most people, actually use pre-made decks. So there are some people who have made decks already, like comprehensive decks of flashcards, like 10,000 or 20,000 flashcards, and they just upload them, and then people download the flashcards and use them. This is one way of using it. The other way of using it is to make your own deck, so to make your own cards. I think this is the best way to use it. This is how I use it personally, and I think it was very helpful to make my own cards. And the source of information is UWorld. So use UWorld as your main source for making the cards. Again, if you find a new concept in one of the explanations for a question, if you got it right or if you got it wrong, doesn't matter. If it's a new concept, just add it as a new flashcard. So in my opinion, it was more useful for me to make the cards rather than like review them. Reviewing them, of course, is really important, but it was very useful for me to make the cards. That's why I think that you should make your own decks, because just the process of extracting information from UWorld into a card on Anki is really helpful for me. Also, reviewing it and keeping up with your decks, with your reviews every day is still as important. Okay, so now like I'll give you a rough timeline for studying for the USMLE Step 1. You have two parts for preparation. There's the pre-dedicated preparation, which is just in general what you do before the USMLE, like in first, second, third, and fourth year of medical school. This is my recommendation. This is what I did. So during first, second, third, and fourth year of medical school, you have the pre-dedicated preparation. And then the dedicated preparation starts a few months before your actual exam. My recommendation is to start like July 1st in fourth year, so after your fourth year. This is for people in second faculty. It might be a bit different for people in third faculty, but for second, I think in first faculty as well. And I think, I'm not sure about the other faculties in Czech Republic, but my recommendation in general is to start in the summer of your fourth year, start your dedicated. Do the exam, the USMLE Step 1, in August or September of fourth year, so of the summer of fourth year. I'll tell you in a bit like how long it should be exactly and all that. But first, the pre-dedicated. So this is the preparation the first 3 years of medical schools. So it's just simple. You have to try to use USMLE resources while studying for medical school exams. So I recommend starting in 3rd year. This is what I did, but you could start as early as 1st year because there are some 1st year subjects that are important and you can use some USMLE resources for them. So for example, for anatomy, you can use Boards and Beyond videos, you can use the AMBOSS library, and you can also use first aid. For medical biology and genetics, again, Boards and Beyond, AMBOSS, and first aid. For 2nd year subjects have physiology. Everyone already uses Costanzo, I think, but it's actually a American textbook, so it's really useful for the USMLEs. Also, watching relevant Boards and Beyond videos for each chapter is really important, in my opinion. Biochemistry, one of the best subjects on Boards and Beyond was biochemistry. So I think it's really useful if you're studying for your biochemistry exam for medical school to use Boards and Beyond, at least watch the videos once, and to also regularly reference first aid, the book. Okay, for 3rd year, so this is when I started preparing for USMLE. For microbiology, again, sketchy micros. I already talked about this. They're really the best resource for microbiology for medical school and for USMLEs. For pathology, again, I talked about this pathoma. So I also recommend using Boards and Beyond if you have time during like your 3rd year. But pathoma is usually enough for everyone. During 4th year, you have the pharmacology exam. So Kaplan pharmacology was actually good, the videos and the textbook, and also using first aid as a reference. So this is what I recommend doing during the pre-dedicated preparation. So during the 2nd semester of 4th year, so you have to decide where and when you will do the exam. So for example, September in the Prague Prometric Center. And then you have to sign up and pick your 3 months eligibility period. So the way they sign up for the USMLE exam, you can just check it on the website. But basically you have to choose 3 months during which you can pick a date to do the exam. And also another recommendation I have during 4th year, during the summer semester of 4th year, is to start doing 1 block of questions a day from the AMBOSS QBank. So I don't, some people start using UWorld this early, but I don't recommend wasting UWorld questions because one of the most important things is seeing a question for the first time. So I don't recommend doing UWorld prior to dedicated, but I recommend doing AMBOSS. So you can get the AMBOSS QBank and do 40 questions a day and just review them if you have time. So it'll take like 2 hours a day, for example, during your 4th year. This will really prepare you well for the actual exam. And also another recommendation is during 4th year, you can listen to the Divine Intervention podcasts during your free time. So on the tram, for example, you can listen to some podcasts. And these Divine Intervention podcasts, they cover everything in the USMLEs, basically. So dedicated preparation is a period of 30 to 60 days. And during this period, your only focus should be on the preparation for the USMLE Step 1. So it depends on you, like how long you want your dedicated period to be. I think 30 to 60 days is good. I think the optimum time is 50 days. I recommend starting this dedicated preparation as soon as you finish your last exam in 4th year. So for example, you can take 1 week break after you finish your last exam in your 4th year, and then start your dedicated preparation. So you want no distractions during dedicated preparation. So for example, you can do it at home if you'd like. This is what I did. So before you start your preparation, you have to set a goal score. So you have to set a specific score that you want to achieve for the USMLEs. Most people, for example, their goal score is more than 240, which I think is a very good score. So set a goal score. You have to do a baseline self-assessment. So usually this happens on the first day of dedicated. You do a self-assessment in order to establish your baseline. So I'll talk more about the self-assessment in a bit. You want to purchase all the study resources that you plan on using. So my recommended resources, I said, I think already, but I'll just recap. UWorld, First Aid, Boards and Beyond, Master the Boards, and Anki. So as I have a question on the chat, and yes, I'll address this in a bit. I'll address this question in a bit. So my recommended resources are UWorld, First Aid, Boards and Beyond, Master the Boards, the ethics book, and Anki. So first of all, you need to start with a baseline self-assessment, and then based on the score that you get on the baseline self-assessment, the difference between that score and your target score, you can decide on the length of your dedicated preparation. So realistically, I think most people, like if they study really well, they can achieve 30-point increase between their baseline score and their actual score in the USMLEs. People, of course, have achieved a higher increase. So I'm not saying that you can the maximum amount of points that you can increase is 30. But I think realistically for most people, if you study really well during your dedicated preparation, you can increase by 30 points compared to your baseline. And this should take around 30 to 60 days to increase 30 points. Any more than 60 days, I think, is not that useful. And many people agree about that the longer you do your preparation, there's like a point of diminishing returns where it starts getting worse. Your results start getting worse if you do your dedicated preparation, like, for example, for 3 months. So during your dedicated preparation, you have to do a self-assessment every 7 to 10 days to track your progress. This is really important. So every 7 to 10 days, you have to start doing a self-assessment, like an NBME or a UWorld essay. And then according to the results, you have to tune or change your preparation. And I'll talk more about this in a bit. You have to create a daily routine during your dedicated preparation. So, for example, this was my daily routine when I was studying for step 1. So, for example, you have a wake-up time, then you have 1 hour for breakfast and all that, and then you start. You can read this on your own. I'm not gonna read it now, but it's just a routine, and then you have like some breaks in between. So every single day you have to follow this routine. I think this is one of the most useful things that you can do for your dedicated preparation, because it can get very frustrating when you're studying every day for like 12 or 13 or 14 hours for like 2 months straight. So you really need a routine and you need to get used to it. Okay. And of course, breaks as well. Taking breaks is really important on your mental health. So, for example, you can have 1 day a week where you have a break. For me, I took my breaks when I did my self-assessments. So, for example, every 7 days, every week, I would do a self-assessment, and then I would finish that self-assessment in 4 hours, and then the rest of the day I would take the rest of the day off. Okay, so how to effectively use self-assessments. For step 1, there are a total of 8 self-assessments. There are 6 NBMEs and there are 2 UWorld self-assessments. The NBME self-assessments, they're created by the National Board of Medical Examiners. These are the same people who write the questions for the USMLEs. So you would think that these are the most accurate questions, but actually the style of questions on the NBME is not very representative of the real exam. They each cost $60. And the UWorld essay self-assessments are better than the NBMEs because the NBMEs usually the style of questions is a bit different than what you would see on the real exam. Like the clinical vignettes are very short. The answers are not as representative of the real exam. And then I said we have the UWorld essays. There are 2 practice tests, and they come already with a UWorld subscription. They have excellent quality and they're very predictive of your real score. So the UWorld self-assessments are really the best self-assessments, but there are only 2 of them, unfortunately. So how to use it? Again, you start with a baseline. So I recommend the baseline for step 1 is NBME 20. So it's one of the 6 NBMEs called NBME 20. So I recommend doing this self-assessment on the first day of your dedicated or 1 day prior to your dedicated preparation as your baseline. So this is basically to assess your baseline knowledge. So according to the result, you plan the length of your dedicated preparation, which I already talked about. And then according to the result of your baseline or result of every self-assessment, you plan the rest of your dedicated week. So the rest of your week should be focused on doing the week subjects on the self-assessment. So for example, this is a self-assessment that I did. This was my baseline self-assessment, NBME 20. And it showed me that my weak areas were behavioral sciences, also I think gastrointestinal and respiratory and renal. So these were my weak subjects. According to this, I spent the rest of the week dedicated watching Boards and Beyond video on these subjects, on gastrointestinal, on respiratory, renal, and on behavioral sciences. Plus, of course, the UWorld and the Anki, like random UWorld and Anki cards. So this is what I recommend you do. Every week you do a self-assessment and then you change the way that you study for the rest of the week based on what subjects you weren't scoring that well on. So this will really help you improve the knowledge in the weak areas. Okay, so Another thing is that you have to save the most predictive self-assessments for the end of your dedicated period. So the three most predictive ones are the UWorld SA2, the NBME 18, and the Free 120. So what you should do is a few days before your actual exam. So I did this 4 days before my actual exam. I did a mock exam. So I combined UWorld SA2 and Free 120. And this is a total of 7 blocks, which is how long the real exam is. And then I did them back to back. And I made sure to simulate exactly everything that I would do on the real exam. So I woke up on the same time I would wake up on the real exam. I had the same breakfast. I had the same snacks. I calculated the same total break time, so 45 minutes. So I think this is really important to give you an idea of how the real exam is going to be, because this exam is really long. So it's 7 hours of exam, but it's actually 8 hours total with your break time, and that can be like very tiring towards the end. So you want to at least know how you'll perform, and this is like good practice prior to the real exam. And the things that you should do on the exam day, there's like a YouTube video that tells you exactly what to do on the exam day. So what time to sleep, what time to wake up, what should your breakfast be, what kind of snacks you should be eating between each block, and so on. I think this video is really useful. This is what I did on my real exam, so I just gave you the link. Okay, and then now I can talk about the score interpretation for step 1. So the USMLE step 1 scores, they range between 0 to 300. The passing score is 194. The average or the mean score overall is 229 with a standard deviation of 20. In general, a score that is over 240 is very good. So it's considered very good, and it keeps all the doors open. So you can basically apply it to any residency program that you want. Nothing is off limit if you score more than 240. If you score more than 250, it's considered an excellent score. And this gives you like a good advantage over other candidates. If you score over 260, it's exceptional, and it basically puts you in the 99th percentile. So this is like the percentile graph for the USMLE. So over 250 is 84th percentile, over 260, 96th percentile, and so on. And you can see that the USMLE step 1 scores are in general a bit lower than the USMLE step 2 CK scores. I'll talk about it a bit. Someone asked this question on the chat. So there are going to be changes. I think it's still official. It will change into a pass-fail format in 2022. I think it's in January 2022, but they are like, I think, talking about some kinds of delay that might happen. But anyway, the announcement was that they will no longer report scores for the USMLE step 1. This is, of course, like in my opinion, it's a horrible change for IMGs because we basically lost our advantage over US graduates. Because normally, like if you and a US graduate applied to the same residency position, like the only reason basically that the person screening the applicants will look at your application and will ask you for an interview rather than the US graduate is if you've had like a much higher score. Of course, there are other aspects like electives and research and so on, but it's always been that the USMLE step 1 score was the most important aspect of your application. Now that it's pass-fail, it basically does not, there's no more advantage for us. If you score high on the USMLE step 1, this advantage has been lost. Of course, if you do the exam before 2022, so if you do it next year, or this year, I don't think this year is possible anymore, but if you do the exam next year, your score will still be reported. And when you apply for the residency programs, your score will be part of the application. So I recommend doing that because pass-fail format is not very useful for us. And also what's likely going to happen is that the focus of the residency programs will shift from the USMLE score to the USMLE step 2 CK scores. So we will probably be screened based on our USMLE step 2 CK scores. So I don't know if this is a good thing or a bad thing. It depends on your scores, but this is probably what's going to happen. So I don't think they really achieved like anything by changing it to the pass-fail format. Okay. So that's it for USMLE step 1. So I think we can take a 5-minute break if you'd like, and then we can start USMLE step 2 CK. Is everyone fine? Do you have any questions before we take the break? No, okay, it's fine.
Okay, so we shall resume at 7 o'clock then, I guess. The lecture will be posted on YouTube later on, for sure.
Okay, hi everyone. I think it's time to start again.
Yeah, you can start now.
Okay. So the second part of my presentation is going to be about the USMLE Step 2 CK. Okay, so again, the exam structure is very similar to the USMLE Step 1. However, it's a bit longer, so it has one extra block. Instead of 280 questions, you have 318 multiple choice questions. Again, single best answer. The total exam time is 9 hours compared to the 8 hours in USMLE Step 1. It's the same 60 minutes are allocated per block, and there's a 45-minute total break time. So it's very similar to step 1. The only difference is it's a bit longer. The content is different in USMLE Step 2 CK. So the USMLE Step 2 CK is a test that tests you on your clinical knowledge. So this includes more clinical aspects of medicine, such as patient care, the ability to interpret laboratory studies, the ability to diagnose the patient, your knowledge about prognosis and outcome of certain diseases. A very important part, and it's becoming more and more common on USMLE Step 2 CK, is health maintenance and disease prevention. So screening tests and so on. Pharmacotherapy is also important, clinical interventions, mixed management, and then also a big part is professionalism, which I'll tell you about in a bit. I'll give you an example. According to system, you have very similar systems to USMLE Step 1. So there is general principles, but general principles is not very commonly tested on Step 2 CK. So general principles, by this they mean USMLE Step 1 content, like basic principles, basic sciences. And there's again immune system, hematology, behavioral, nervous system. So it's very similar to Step 1 in terms of systems. In terms of the disciplines, it's completely different from USMLE Step 1. It covers internal medicine, which is the most covered part or the most tested part of the USMLE Step 2 CK is internal medicine. So approximately half of the questions are going to be about internal medicine. Surgery is also tested, pediatrics, obstetrics and gynecology, and psychiatry. So these are the 5 disciplines that are tested on USMLE Step 2 CK. So this is an example of a question. So let's just go through it together. And also the questions on USMLE Step 2 CK, they tend to be a bit longer. And a lot of them, they have laboratory findings, which I didn't include here. Like this question doesn't have laboratory findings, but a lot of questions on USMLE Step 2 CK have laboratory findings, so they're generally longer questions. So a 16-year-old boy is brought to the ER because of a 2-day history of fever, nausea, vomiting, headaches, chills, fatigue. He has not had any sick contacts. He underwent splenectomy for traumatic injury at the age of 13. He has no other history of serious illnesses and takes no medication. He appears ill. He has a fever, tachycardia, respiration is 14, blood pressure is 110/60. On pulmonary examination, there are scattered crackles heard bilaterally. The abdominal examination shows a well-healed midline scar and mild diffuse tenderness to palpation. Which of the following is the most appropriate next step in management? So this is a very common type of question in USMLE Step 2 CK. This is a question that's asking you about the most appropriate next step in management. So it's not asking you about what are you going to do next in general. So what are the steps? So for example, here in our oral exams, they tend to ask us, okay, so how would you diagnose this patient? How would you treat this patient? But on the USMLE Step 2 CK, they really want to know whether you know what to do next immediately. So this is an emergency situation. So let's extract some important information. We have a 16-year-old boy. He has fever, nausea, vomiting, headaches, chills, and fatigue. So he's very sick. He has not had any sick contacts. And very important aspect about his history is that he has underwent a splenectomy for traumatic injury at the age of 13. So he's a patient who's had a splenectomy. And then the rest of the stuff is not really that useful, but he has a fever, he has crackles in his lungs, and he has abdominal pain. So what's the next step in management? I think in the chat, one person answered it correctly. So one person said D, and one person said A. So D is incorrect. X-ray of the abdomen is, you would eventually do X-ray of the abdomen maybe, but this patient has splenectomy, and now he's having signs and symptoms of a disseminated infection. So there's signs and symptoms of pneumonia, there might be sepsis, there might be some abdominal infection like peritonitis. So this patient has a splenectomy and has a disseminated infection. It's a very emergency situation. You need to immediately start broad spectrum IV antibiotic therapy. And this is like something that you learn when you're studying Step 2 CK, or when you're studying clinical medicine in general. Someone with a splenectomy, the most common cause of sepsis in these patients is Streptococcus pneumonia, which some of you may already know from basic sciences. The spleen is very important for clearing encapsulated organisms like Streptococcus pneumonia. So if a patient has splenectomy and then he has signs and symptoms of sepsis, you need to immediately start antibiotics prior to doing anything. So maybe you'll do later a CT scan of the chest, an X-ray of the abdomen, but immediately you need to start antibiotic therapy. So this is a very common type of question on USMLE Step 2 CK, a question that assesses your ability to deal with patients immediately. So to know what the best next step in management is. Okay, so in terms of this is testing you on your clinical interventions, patient care. According to system, it's blood and lymphoreticulaire system, so hematology. And according to discipline, it's internal medicine. Okay, so the next question is a bit long. So we have a previously healthy 29-year-old woman. She admitted to the hospital because of a one-day history of headache, fever, lethargy. 2 days ago, she underwent wisdom tooth extraction. She takes no medication. She cannot remember her vaccination history. She does not smoke cigarettes, drink alcohol, or use illicit drugs. She is a college student, lives in an apartment complex with other students, and eats all her meals at the campus dining hall. She says her study partner has a really bad fever during the past week. The patient appears sleepy, very high temperature, low blood pressure, tachycardia. There's a diffuse purpura crashing of the trunk and extremity. There's nuchal rigidity. The rest of the stuff is not that useful, but it's asking you which of the following is most likely to have prevented this patient's current condition. So this is several steps for this question. You have to know what the diagnosis is. You have to know how to prevent it. So again, some useful information. This is a 29-year-old woman. So this disease is common in this age group. She has history of headache, fever, lethargy. So this is not very useful because a lot of diseases can present with headache, fever, and lethargy. 2 days ago, she underwent wisdom tooth extraction. So they're telling you this for a reason. They're telling you that this kind of disease tends to happen to people after they've had some kind of mucosal injury. She does not smoke cigarettes, drink alcohol, use illicit drugs. She is a college student. This is a really important hint to this question. She's a college student, and she lives in an apartment complex with other students. This is a disease that usually happens in college students. And her study partner had a really bad fever, so it's most likely transmitted from her study partner. She appears sleepy. This is important. It's telling you that she has altered mental status, which means a brain infection. She has a very high fever, tachycardia, low blood pressure. She's most likely septic as well. She has sepsis. She has a diffuse purpuric rash, and there's nuchal rigidity. So already most of you should know, if you've already studied microbiology, you should know what this disease is. This disease is meningitis, meningococcal meningitis, so Neisseria meningitidis infection. And then they're asking you about what is the most likely to have prevented this patient's current condition. So what is the best way to prevent meningococcal infection? So let's see the answer. Yeah, so again, some of you have answered it correctly. So the answer is adherence to immunization guidelines. So there's a vaccine against meningococcus, and then every college student is indicated for this vaccination, especially if they're living in dormitories. So people who are high risk for meningococcal infections, like college students or army recruits, they're indicated for vaccination with the vaccine. And this is the most important step in order to prevent this infection. Some of the other answers are also a bit correct. For example, consistent hand washing could also be correct, even though slightly, like, it's not that correct, but could be. Isolation of other students on campus with febrile illness. This step would also decrease the transmission of this infection, but it's not the most important step. Prophylactic antibiotic therapy is also a type of prevention, secondary prophylaxis for meningitis. So anyone who's been in contact with this patient who's now has meningococcal meningitis needs to receive prophylactic antibiotic therapy, but this is not as important as immunization. So you see that there are multiple correct answers, but really only one of them is like most correct. So this is testing you on health maintenance and disease prevention. So your ability to know how to prevent diseases with vaccinations mostly. System is neurology, nervous system, and special senses, and discipline again is internal medicine. So the last example, so this is also a very common kind of question on the USMLE Step 2 CK. So it's it might be very weird for us and our faculties because we don't get examined on this aspect of medicine at all. No one teaches us this aspect of medicine, but this is about patient communication. So a 22-year-old primogravid woman at 10 weeks gestation comes to the ER because of a 3-day history of persistent vomiting. She is treated with intravenous hydration, pyridoxine, and doxylamine. As the resident physician prepares the patient for discharge, he asks who will be picking her up from the emergency department. She says her husband will be arriving soon and asks if the hospital staff can refer to her symptoms as a stomach flu. She does not want anyone to mention to her husband that she is pregnant because the pregnancy resulted from an oral contraceptive failure, and he is not expecting this. Which of the following is the most appropriate next question to ask this patient? So, like you'll get used to. So for example, the way that you prepare for these types of questions is just by doing practice questions on New World. There are a lot of them on New World, and they'll prepare you. Another thing is that you have to read the medical ethics book that I recommended. But in general, like the answer is B, how do you think he will react? And the reason for that is that, first of all, one principle is every woman who's having a checkup or for any reason is in the hospital needs to be screened for intimate partner violence at every doctor visit. And some specific women are at risk of intimate partner violence, like younger women or first pregnancies or in the postpartum period. So you always have to screen them. And the way that you screen women for intimate partner violence is to ask non-confrontational questions. So you don't want to be too confrontational. You don't want to assume anything. So you should ask, how do you think he will react, just to get an open-ended response from the patient. Other things are, for example, will he try to force you to do something that you aren't comfortable with? This could be a question that you'll ask later on. So first you'll start with an open-ended question. And then, for example, she'll explain that she's scared or so something. So that's why you need an open-ended question. And then eventually you'll ask if her husband might try to force her to do something. So this is a type of question that's very common on the USMLEs. This is based on tests on system-based practice and patient safety, social sciences, legal and ethical issues, and a discipline is obstetrics and gynecology. But you'll meet a lot of these questions. So for example, I think on my exam, I had maybe 20 questions that were testing me about this patient communication skills. So this might be one of the most difficult parts in preparation for the USMLEs because we're not very used to this part of medicine. Okay, so the study resources for Step 2 CK. So you have books. The Master of the Board's Medical Ethics is the only book that I personally think that you should buy if you haven't already bought it for Step 1. It's the same book as for Step 1. They both cover the same parts of medical ethics. There is a first aid book. So first aid for the US. I don't personally recommend the the first aid for the USMLE Step 2 CK. There is a first aid for USMLE Step 1 is useful because like I think that it was very useful for me during preparation for Step 2 CK to go through old topics from USMLE Step 1 because there are some topics from USMLE Step 1 that are tested on USMLE Step 2 CK. So these two books are really the only two books you'll use. Medical ethics book and first aid for Step 1. First aid for Step 2 CK is not very useful. The video resources, again, there aren't that many video resources for Step 2 CK. Online MedEd is a resource that a lot of people use. I don't personally recommend to use online MedEd. I used it myself in the beginning, and I found that a lot of the information on online MedEd is a bit outdated or incorrect or too broad, so not as detailed as you need it to be. But it is useful to some people because it gives you a sort of baseline for Step 2 CK, an introduction into the clinical sciences. So it might be useful for some people. It wasn't useful for me. So QBanks, you have UWorld, again, must use. This is the best resource for USMLE Step 2 CK. So the UWorld QBank. There's also the AMBOSS QBank, which again, I highly recommend using the AMBOSS QBank. I'll tell you in a bit how to use it. There are self-assessments, the same way that there are self-assessments for Step 1. There are also self-assessments for Step 2 CK. There's UWorld SA1 and 2, and there are 3 NBME self-assessments. Then the other resources that I think you must use, the Divine Intervention podcasts, you really have to use this, and the Anki flashcards, you really have to use it again for Step 2 CK. So my recommendations: UWorld, AMBOSS Library plus QBank, Anki flashcard, Divine Intervention podcasts, and then the books Master of the Board's Medical Ethics and First Aid for USMLE Step 1. Okay, so for UWorld for step 2 CK is basically all you need during dedicated. So all you need is UWorld during dedicated. You don't need any video resource like Beyond, for example. You only need UWorld plus Anki. So to do the UWorld blocks and then to do the Anki cards, the same way I talked about for step 1. So use UWorld only during your dedicated. Do 2 blocks a day on timed random mode. You have to review every single question and make Anki cards based on the explanations on UWorld. You have to try to go through all the questions once on timed random, and then you can do a second run through of incorrects only if you have the time to do that. So the same thing that I said for step 1 basically applies here as well. Amboss is the best resource to use during pre-dedicated preparation. It is really good for step 2 CK. I didn't use it that much for step 1, but for step 2 CK, it's an excellent resource. So it has a library, and the library has articles that cover every single important topic, basically, for step 2 CK, especially internal medicine. And it also has a Q bank. You can use this Q bank before you're dedicated, so in the pre-dedicated period, in order to get used to step 2 CK style of questions. And it's excellent as a reference during dedicated preparation. So during your dedicated preparation, if you forgot a concept or you found that the explanation on UWorld wasn't enough for you, you can also reference Amboss. Okay. The Anki flashcards, it's the same as for step 1. So you have to make your own flashcards on every topic that is covered by UWorld. You have to review the cards daily. So for at least 2 hours a day, you review the cards. You have to start low and go slow, which means that you start with a small amount of new cards per day. So then the amount of cards that you can see per day from your deck can be like in the beginning 10 to 30 cards. Then you gradually increase the number of new cards. And maximum, I think for me, the maximum was 100 per day. Or I think in general, the maximum was 100 per day. I think I only did 17 new cards per day maximum because I didn't want to overwhelm my memorization capacity. You want to aim for 200 reviews per day and 50 to 70 new cards per day. That's like the optimum goal for doing Anki flashcards every day. I recommend starting your deck, start making new cards during dedicated. So as soon as you start dedicated, as soon as you do your first UWorld block, you start doing your new Anki flashcards, start creating your Anki flashcards, and then you just keep up with them during your dedicated. Divine Intervention Podcast is like an excellent podcast series. It's made by a US doctor. It covers basically every important topic on the step 1 and step 2 CK. There are certain podcasts that you must listen to for step 2 CK. That's why I wrote it down as a must-use resource, because there really are like certain episodes of this podcast that you have to listen to, especially in the few days before the exam itself, your real exam. So there's risk factors, episodes 37, 94, 97, 184, so on. So there's like episodes on risk factors, episodes on military medicine, episodes on immunodeficiency that you have to watch because they're not really covered by any other resource other than Divine Intervention Podcast. And then there are podcasts that I recommend listening to only if you have the time, like the Rapid Review series for Step 2 CK and the Geriatrics episode. So there's a timeline. This is my recommended timeline for Step 2 CK. So the pre-dedicated preparation, you can start during the beginning of 5th year. It can cover the entire 5th year. You can even start as early as 4th year if you want. And then the dedicated preparation, you should start in July of 5th year. And then you should do your exam in August or September of 5th year. So pre-dedicated preparation is very similar to step 1, pre-dedicated preparation. So what you're trying to do is trying to use the USMLE resources to study for 5th year and maybe 4th year exams as well. And the absolute best resource for this is Amboss. So the Amboss library and the Amboss QBank. So you study the exam questions from the Amboss library. And then this is really important because it ensures that you have background knowledge prior to starting dedicated. During the summer semester of 5th year, you can start also doing 1 or 2 Amboss QBank blocks per day if you want, if you have the time. Again, this helps you get in the mood for doing Step 2 CK questions. And again, during your pre-dedicated, you can listen to some Divine Intervention podcasts in your free time. So for Step 2 CK, the ideal duration for dedicated preparation is 2 months. So you start as soon as you finish the last 5th year exam. For example, you start on July 1st. And then prior to starting dedicated, same for step 1, you have to do a baseline self-assessment. I recommend NBME 7, and you have to establish a target score. Most people, their target score for step 2 CK is more than 250. If you want to like do well on it, this basically is a good score. and then decide on and purchase all the resources you'll use. Again, my recommended resources for Step 2 CK are UWorld, Anki flashcards, Amboss Library for Reference, and Divine Intervention podcasts. So you can see there are a lot less resources for Step 2 CK compared to Step 1, or a lot less useful resources, at least. So during your dedicated preparation, you have to have a daily structure, very similar to Step 1 daily structure. And the entire dedicated period should revolve around UWorld, Anki, and self-assessments. So this was my dedicated preparation. So I had this application on my phone. It's called Microsoft To Do, Microsoft List. And I just had every day wake up, do Anki cards, and do a UWorld block, 30-minute break, revise the UWorld block, do Anki cards again, then 30-minute break, UWorld block, so on. You see, it's like repetitive. You're only doing Anki cards and then UWorld block. And then one day a week, or every 10 days, I did a self-assessment, and then I took the rest of the day off. So this is really important, same as how it was important for Step 1. It's really important for Step 2 CK to have a structure every day. Self-assessments for Step 2 CK are very similar to Step 1. You have 2 UWorld essays, but you have only 3 NBMEs, and then you have the free 120 self-assessment. I recommend doing the NBME 7 as the baseline, and then doing 1 self-assessment every 10 days. And very similar to what you did in Step 1, I recommend also Step 2 CK, like on the last week of dedicated, so a few days before your real exam, do back-to-back UWorld Essay 2 plus free 120 as a simulation for the real exam. And then the same way that you did for, or that I recommend doing for Step 1, you should also do for Step 2 CK. So every 10 days, you do a self-assessment, and then according to what you were weak on that self-assessments, you plan the rest of your week studying or referencing articles from Amboss Library. So you read some of your weak subjects. For example, on 1 week, if you get nephrology, you're bad at nephrology, on 1 self-assessment, you spend 7 days or 10 days reading through the nephrology section in Amboss. Score interpretation. So the mean Step 2 CK score is 240. So it's 10 points higher than Step 1. And basically, what's recommended is that you should at least aim for a score equal to or higher than your Step 1 score. More than 250 is considered a very good score. More than 260 is considered an excellent score. And more than 270 is considered an exceptional score. And I think, in my opinion, in the future, the Step 2 CK score will be the most important part of the application as an IMG, because the Step 1 will become pass and fail or pass-fail. So this will be really important. So really try to focus on studying for Step 2 CK. This is the percentile. So for example, it's you can see it's a bit higher than Step 1. So for example, 260 is 84th percentile, 270 is 97th percentile, 275 is 99th percentile on Step 2 CK. You should at least try to aim above 240 if you have scored 240 on Step 1, or you should at least try to aim for your Step 1 score. So in conclusion, several things I wanted to say. First of all, you need to decide early on in med school whether or not you want to do the USMLEs. I gave you some reasons why you should do the USMLEs other than just practicing medicine in the US. There are a lot of good reasons. So you should decide early on. You should start preparing as soon as possible by using USMLE resources. So I don't mean preparation as in dedicated preparation every day, but I just mean just generally using USMLE resources for your med school exams. You should try to do as many high quality practice questions as possible. And the focus is on high quality because there are a lot of low quality practice questions. There are a lot of Q banks that are not that good. So you should try to do high quality practice questions. For Step 1, that is UWorld essay, UWorld and maybe also Amboss. And for Step 2 CK, again, also UWorld and Amboss, in my opinion, are the best Q bank questions. Another recommendation is to create your own Anki decks. And then finally, regular self-assessments throughout your dedicated preparation. So just my experience, in case you're curious, for Step 1, basically I decided to do USMLEs when I was in 3rd year. That's when I decided I wanted to do the USMLEs. I used Pathoma and Sketchy Micro study for 3rd year exams, and then I watched Boards and Beyond videos throughout 4th year. So just when I was doing my 4th year exams, I was watching Boards and Beyond videos. I submitted my application and I picked an eligibility period in April of my 4th year. And then I started dedicated on the 1st of July. During dedicated, I used UWorld and Boards and Beyond and the regular self-assessments. And my dedicated period lasted exactly 43 days. It was a bit long, but it's still in between 30 and 60 days, which is good. My step one exam was actually easier than I expected, the real exam. And I scored exactly my predicted score, so according to my self-assessments. Step 2 CK, so the way that I did pre-dedicated preparation is that I used AMBOSS throughout 5th year. So especially when I was studying for my internal medicine credit tester, I used AMBOSS to study for every single question. So this was really useful for me. I think it was very important that I did that. My plan to do the Step 2 CK in summer was ruined because of the pandemic, so I basically started my dedicated months earlier than I had planned. My dedicated period started on April 1st. So once the lockdown began, I went home and I started studying for Step 2 CK. During dedicated, I used UWorld and Anki as my main resources, plus self-assessments and divine intervention podcast. My dedicated period was really long. It was 74 days. It was like much longer than I needed actually. And the reason for that is because there were problems with like signing up for dates. There weren't enough dates because of the pandemic. So there were problems, but my dedicated was very long. It should have been like at least 2 or 3 weeks shorter, in my opinion. The Step 2 CK exam was actually really difficult. It was much harder than I expected, but somehow I scored higher than my predicted score, so it was fine. So these are some useful links that I just put, so in case you get the presentation. And that's it for my presentation. And we have some time for questions. So if any of you have questions, you can write them in the chat, or you can just open your mic and ask the questions.
Yeah, I have a question, Ayman.
Yes.
Now it's something I kind of noticed. Maybe I'm just overthinking it, but so I'm studying for my micro final, right? And I look at Sketchy. I watch Sketchy first, where they give treatment for like such as antibiotics for bacteria. Then I read through Murray's treatment section, and they have different antibiotics, and they'd say that this thing that's on Sketchy is now outdated and we don't use it anymore. You know, it's like second line now.
Yeah.
So should I so for the USMLE purposes, should I just stick to Sketchy, or should I just use what Murray is saying? You know what I'm saying?
Which Murray's version are you using? Like, are you using the latest version?
Yeah, 9th edition or 8th edition.
Yeah, then I think that would have the most accurate antibiotics. But you know, like, yeah, there are some mistakes in Sketchy because it's like very old. I don't know, I think it's 10 years old or something. So there are some changes in terms of management. But I think this problem will like easily be solved when you're doing UWorld. So as you're doing UWorld, you'll see a lot of microbiology questions. And then you'll see that, for example, something was wrong in Sketchy and you'll just correct it on your Anki, for example, or something. But it's not a big problem because Sketchy just gives you the baseline for micro. I said that it's like it covered everything on my exam. That was true. But yes, you're right that there are some treatments that were a bit different that were wrong, but you just have to focus on UWorld explanations for that.
All right then. All right. Thank you so much.
Yeah. Okay, any other questions?
I think there was a question in the chat box.
Okay. What do you think about doing Step 2 CK before Step 1 for a post-grad IMG? I don't have experience with this, but in my opinion, it shouldn't be that difficult. It shouldn't be that bad because you've already graduated. You've already done the state exams, so you already have the information about internal medicine, pediatric surgery, and so on. There wasn't so much Step 1 questions on the Step 2 CK. There were some, of course, like there were some basic science questions. But I don't think it's going to be a problem if you do Step 2 CK before Step 1, especially if you've already like graduated. Of course, for you, it will be more difficult to do Step 1 because it's been a long time since you've done any basic sciences. So yeah, I don't think it's a problem. Maybe try to use first aid for Step 1 together with your preparation. Like try to incorporate first aid for USMLE Step 1 in your Step 2 CK preparation. That's what I did, and I think it was useful because there were some questions covering the basic sciences. So that's it. Like I don't think it's that big of a problem actually.
Question.
Yeah.
So as you mentioned that in the disadvantage of it being pass and fail is that the extra resources, and I can't do the test anytime before 2022 because I'm still in my second year. So my question is, what are some research opportunities in the Czech Republic, or you just did them maybe in the Czech Republic, or you were able to contact doctors outside of the Czech Republic and all that for research, internship, etc.?
So you're asking me about research for resident, like in order to improve your application for residency.
Yes, exactly. Your extracurriculars, basically.
Yeah, of course. I think your application for residency is not just about the USMLE scores. It's also about your research, also about your clinical experience, US clinical experience. So in terms of research, there are a lot of research opportunities in our faculty. Like if you ask doctors, they're doing a lot of research. Some of them may not be that useful. So it's always like better to try to do research in the US if you have the opportunity to do that. Just like contact doctors by email, just find doctors that are doing things that you're interested in, like whatever you're interested in, just try to find doctors in the US and just email them that you're interested in doing research with them and they will reply to you. In terms of US clinical experience, I actually don't have any myself because it was all ruined by the pandemic. I was planning to do my 6th year, at least some of it in the US, but I couldn't because of the pandemic. But there are several ways to do clinical experience in the US. You can apply directly to medical schools or to universities like the Mayo Clinic program or the Cleveland Clinic program. So these are like you just pay an application fee and they just accept you based on your application and based on your USMLE scores. And then you can just do like your internal medicine, for example, over there, or surgery. That's one way. Another way is to go through one of these AMO opportunities or med clerkships. Some people also do that, but these are mostly observerships, not electives. But I don't really have that much experience with that, so I don't really have any advice to give you in terms of electives, in terms of US clinical experience. But yeah, of course, research and clinical experience is as important as the USMLE scores for your application.
Okay, thank you. So like the fact, like usually, what I know, there's people would hire like more publications and stuff like that. It makes their application much, much better. But is that 100% necessary or not really?
It depends on what specialty you would like to do. So for some specialties, it's not necessary, but like really, it's not a requirement. But mostly people who get accepted into these specialties have a lot of research. Like usually these are surgical specialties, and like very competitive specialties like neurosurgery, dermatology, orthopedic surgery, so on. So for these, you need to have some research, and you also need to have some clinical experience. For some specialties, you really don't, like internal medicine or family medicine or pathology or psychiatry. You really don't need that much research. You don't need any research at all. And you can even get accepted with only a good USMLE score. I hope that answered your question. Okay, so we have another question. How much time is necessary? How much time is necessary preparing for all steps? For step 1, I said, excuse me? Okay, well, for step 1, is someone asking a question?
Mic is on by mistake.
Yeah, that's all.
Oh, someone's mic is on by mistake. Hello, can you hear me?
Yeah, we can hear you. Okay, sorry.
Okay, so I'll just answer the question that was in the chat. Someone asked how much time is necessary for preparing for all the steps. So for step 1, as I said, like you need a dedicated preparation of around 30 to 60 days. And then you need to prepare during your second semester of 4th year, which is my recommendation, which is about 3 to 6 months. So in total, it should take you around maybe 8 months in total to prepare for step 1. The pre-dedicated preparation that I'm talking about, these 6 months where you're preparing using USMLE resources for studying for med school exams, they're not as important as a dedicated preparation. So you can directly go into dedicated preparation if you feel like you have enough knowledge. If you're doing well in your exams and you feel like you have knowledge already, you might not need these 6 months. So just go directly into dedicated preparation. So 1 to 2 months, 30 to 60 days. That's for step 1. For step 2 CK, again the same thing. So you can also go directly in dedicated preparation. So that would take you 30 to 60 days. or you can choose to do the pre-dedicated preparation as well, which is around 6 months as well, like during 5th year. But yeah, I think in total for step 1 and step 2 CK, you can do them if you want. If you don't have the time to wait for years, you can do both of them in maybe 6 months, like just both exams in 6 months. So for example, 3 months for step 1 and then 3 months for step 2 CK. I know some people who've done both of them back to back, and they've done well on both, but only if you think you have good knowledge prior to starting. Okay. Any more questions? Okay, so I guess there are no more questions. So of course, if you have any questions later, you can message me. Okay, maybe there is a question. No. Okay, so if you have any more questions later, you can message me on Facebook or on Instagram, and I'll try to reply to your questions, of course. So I hope this was useful, and I hope you enjoyed this. And Merry Christmas, everyone. Bye.
Okay, before we go, I just wanted to give a few messages on behalf of UIMS. So 1 second.
Oh yeah, sorry. Yeah, go ahead.
Sorry. Thank you for the lovely presentation, by the way. It was in such good detail. I'm sure it answered everyone's questions really nicely too. Okay, just a brief overview of our upcoming calendar. So the one confirmed event we have is the gingerbread cookies and house competition, running from the 17th to the 22nd of December until midnight, and it will be judged on the 23rd of December. We will also be having various other events upcoming in the next few months, which will be available and announced on our social media accounts soon. And just thank you for your attention, and to please give us any feedback for the event and any questions, message us or Eamon. And that's all basically. Thank you.
Thank you. Bye.
Have a good day, man.